Hello, coders. Good morning, good evening, good afternoon, all depending upon where you're joining us from. Welcome, everyone, to the CPT Guideline Mastery session with AMCI. So, first of all, please, if someone from the team can let me know if I sound good, and yeah, please let me know in the chat. Okay, so let me see who all are here with us today. I can see Miss Mills as always. Hi, Miss Mills, welcome. Miss Catherine is here. The Star Wars Girls is also here, and I can see who else are here. Letty Reina is here. Terry is here. Hi, Miss Terry. Okay, I can see. Hi, Mima Godzavo. I'm sorry if I pronounce it wrongly. Okay, Miss Vina is here. So I can see a lot of you are joining here. Thank you, Miss Mills, for letting me know that my mic is good. So once again, welcome everyone to another CPT Guideline Mastery session with AMCI. So I hope you all are doing, and we have a good topic to discuss today. And I don't want to waste any time. We will dive straight into today's topic. First of all, let me read out the copyright. CPT Copyright 2026 American Medical Association All Right Reserved. CPC is a registered trademark of AAPC. The AAPC content found within this presentation is a copyright of AAPC. Keyword concept FTR Chon, AMCI Fab 7, AMCI ICD 10 Flip Tab, and MCG are the trademark of AMCI. The credential CPC, CRC, COC, CPMA, CPB, CPPM, CPCO are owned by AAPC. AMCI do not own right to these credentials, and the credential CCA, CCS, CCSP, RHIA, RHIT are owned by AHIMA. AMCI do not own right to these credentials. Okay, now before we start today's session, as always, I have a small request to you all. Please don't forget to fill out the survey form which we would share towards the end of the session as well. I'm also sharing, by the way, I'm sharing it now as well. So please don't forget to fill out the survey form. I would really like to see the feedback from everyone who have joined us today's for today's live session, because your feedback help us to improve and bring you even better sessions in the future. Okay, so it will take just less than a minute. Please make sure you fill out the survey form at the end of the session. Thank you in advance. Now, today's topic. Yes, today we are going to dive into the medicine chapter, and we are going to pick some topics from medicine section. The topics are sleep medicine, nerve conduction, and electromyography coding, otherwise I think EMG coding. Okay, electromyography is EMG coding. So today's topic, as I said, you will find it in the medicine chapter, and nerve conduction studies, EMG, and sleep medicine uh, are there under specifically under the topic neurology and neuromuscular procedures section. All right, so there you go. These are the topics which we are going to discuss today. First of all, let's begin with the sleep medicine, and they are quoted from 95803 through 95783. All right. Now, let's begin with the introduction to sleep medicine. Sleep medicine is actually a specialty, a medical specialty that is focused on diagnosing and treating sleep disorders that affect patients' sleep quality and overall health, as well as a daily functioning. Now, there are several common sleep disorders that provider encounter in the clinical practice. One of them is insomnia, which is, in short, trouble falling or staying asleep. Next, we have obstructive sleep apnea. This is another major condition, and mostly the sleep studies are done for obstructive sleep apnea. I've seen more cases of the sleep studies done for obstructive sleep apnea, where the breathing repeatedly pauses during the sleep, and often leading to fatigue, poor concentration, and other sleep serious health issues. Okay, then we have narcolepsy, which is excessive daytime sleepiness, or sudden sleep attack. So that is a very, very serious condition, especially that will uh, seriously have an impact if you're driving in the daytime, etc. And also there is another condition known as restless leg syndrome, that is urge to move the legs, especially at the night. Okay, so these are some of the sleep disorders for which the sleep study is performed. Now, before we jump into CPT coding for the sleep medicine, let's first understand some of the important terms you will see throughout this section. So these definitions are there in your CPT manual. So you can, if you open your sleep study or sleep medicine section, you will find these definitions. So first of all, we have sleep testing, also called as sleep study. Now, this simply means monitoring patient while they sleep to track the things like brain activity, the breathing, and heart rate, oxygen level, all those kind of things. Okay, then we have something which is called as attended. So CPT defines attended uh, sleep testing. That means it is supervised sleep study. A technologist or a healthcare professional is physically present during the test to monitor the patient, fix technical problems, and also respond to the issues that occur. So, if a patient is undergoing sleep study testing, a technician or a qualified healthcare professional will be there along with the patient. And on the other hand, unattended sleep testing means that patient is tested without the healthcare professional presence. Okay, and often it is done at home using portable monitoring equipments. Now, another important term is sleep staging. Now, sleep staging helps to identify stages of sleep of the patient. It is done by analyzing the brain waves, the eye movements, the muscle activities. So, in simple terms, it tells us how deeply the patient is sleeping throughout the night. Okay. Next, we have total sleep time. Now, this refers to the actual amount of time the patient spent asleep during the study, not just the amount of the time they spend lying. It measures actual time the patient sleeps. And then we have sleep latency. This is the amount of the time it takes for a person to fall asleep after the study begins or after the lights are turned off. So all these definitions you will find in your CPT manual. Now, next we have something called as maintenance of wakefulness test, or MWT. This test actually measures how well a person can stay awake during a quiet or in a quiet environment, and it is commonly used to evaluate excessive daytime sleepiness. Okay, next we have multiple sleep latency. This is also known as MSLT. Now, this test measures how quickly a person falls asleep during a scheduled nap periods throughout a day. In simple terms, it helps to determine how sleepy a patient really is, and is commonly used for the evaluation of conditions like narcolepsy, which I mentioned in the beginning. Okay, now let's talk about peripheral arterial tonometry, or PAT. Now, this technique measures blood volume changes in the fingertip and helps to evaluate breath related sleep disorders by analyzing changes linked to the nervous system and the blood flow during the sleep. So there will be a small device that will be placed in your on your finger, and that will do all the analysis. All right, there is another important term or another device used, that is known as actigraphy. Actigraphy uses a small portable device. You can see in the slide the image of the device. It's similar to like your wrist watch, and the main purpose is to track the movement over time. All right, so that will be also attached to the wrist while doing actigraphy. And then we have EOG, or electrooculogram. This records the eye movement during the sleep. So some people will have a very rapid eye movement. So electrooculogram is used to measure those or monitor those eye movements during the sleep. Okay, and those eye movements are really, really important. Now let's go over few more terminology, and these terminologies are mostly related to the respiratory monitoring. First, we have positive airway pressure, or PAP therapy. Okay, PAP devices are actually used to treat the sleep related breathing disorders, especially obstructive sleep apnea. And these machines deliver a pressurized air to help the patient to help keep the airway open while the patient is sleeping. So patients with obstructive sleep apnea, they will have really hard time breathing while sleeping. So PAP, or positive airway pressure, really help those patients to breathe while sleeping. Okay, and the common example includes your CPAP, the continuous positive airway pressure BiPAP as well. Next is a respiratory airflow, also called as a ventilation. This simply refers to the movement of the air in and out of the lungs during breathing. Okay, and another important term is respiratory analysis, and this involves analyzing the breathing patterns and respiratory data collected during the sleep study. Now let's move on to the next one, that is respiratory effort. Respiratory effort refers to the work the chest and the breathing muscles performs in order to breathe. And finally, we have thoracoabdominal movement, and this refers to the movement of the chest and abdomen during the breathing. So all these definitions you will come across while coding the sleep medicine chapter or sleep medicine topic. All right. So I hope you are kind of familiar with this definition by now. So let's move on to polysomnography, which is one of the most important sleep study in sleep medicine. Now, a polysomnography is a comprehensive sleep test that continuously records multiple physiological parameters while a patient is sleeping. So you saw all those parameters, you saw the definitions of a variety of parameters that can be learned or observed during a sleep study. Okay, and to qualify for a polysomnography study, the test must last for at least, I repeat, for at least 6 hours, and must be performed in a sleep laboratory under the supervision of a technologist or qualified healthcare professional. Now, this is considered as an attended sleep study because patient is monitored throughout the testing. So you can see in the image, there is a small image which has been provided. You can see how a sleep or a polysomnography will be performed. So patient will be sleeping. There will be a lot of electrodes. You can see a CPAP, airway support as well over here near the nose, and all those electrodes measures various parameters. All right, and polysomnography is a type of sleep study. Okay, so is that clear, coders? So far good? Let me know in the chat. Let me know in the chat. All right. Okay, so during the study, the polysomnography, several important body functions are recorded at the same time, and these tests include: one, your EEG monitoring using frontal, central, and occipital lead to measure the brain activity. Okay, so EEG measures the brain activities at different stages of the sleep. The next parameter is EMG. EMG is used to monitor the muscle activities, as well as then we have another parameter which is EOG, which is used to monitor the eye movement. All right, so these are the three basic parameters for a sleep study. Most of the sleep study will have these three parameters. And next, in addition, for the polysomnography, in addition to these three sleep staging parameters, you will have four or more other additional parameters, and these parameters include the yes, these includes your ECG, nasal and or oral airflow, respiratory effort, the oxyhemoglobin saturation or otherwise known as SpO2, as well as bilateral anterior tibial EMG. So all these parameters will be also measured during a polysomnography. All right. An important thing to remember is that if a polysomnography is performed for less than 6 hours of recording, then you should append a 52 modifier. So I will come on this point in the later slides. And these are the CPT codes which is used for the sleep study. So let's first look into the attended polysomnography codes. First you can see 9. I've done a small churning here, so it's easy to understand when you churn them. So I highly recommend to churn especially your medicine section. That will be very helpful while you're coding. So you can see how I've done it. So 95808 is for polysomnography of any age, patients of any age, 1 to 3 additional parameters of sleep. Sorry, of sleep. Yes. So there will be 1 to 3 parameters studied on while coding 95808. Then you have 95810, that is for patients of age 6 and over. So there will be 4 additional parameters without CPAP. Then we have 95811, which is used for polysomnography. Age of the patient will be 6 and over. And here 4 additional parameters with CPAP or BiPAP will be done. We have 95782, that is for a polysomnography done on a patient who is younger than 6 years, and there will be only 4 additional parameters measured without CPAP. And finally we have 95783, which is for again polysomnography for patients who is younger than 6. 4 additional parameters will be measured with CPAP or BiPAP. So these are your polysomnography codes. Then let's have a look into the sleep study codes. So the first 3 CPT codes which you see on the screen is for unattended sleep study. So 95806 is for unattended sleep study, and here the parameters measured will be heart rate, oxygen saturation, respiratory airflow, and respiratory effort. While in 95800, the parameters measured, there will be an additional parameter that would be sleep time, which will be measured. While in 95801, there won't be sleep time that measurement. And in 95807, you can see that is the only sleep study which is attended. Okay, so 95807 is for sleep study, simultaneous recording of ventilation, respiratory effort, ECG, or heart rate and oxygen saturation attended by a technologist. Okay, so let's move on. There are a few more, couple more codes. 95803. This code is used for actigraphy testing, and they includes the recording, analysis, interpretation, and report of activity monitoring. And these tests are performed for a minimum 72 hours to 14 consecutive days. All right, and we also have 95805, and it is used for multiple sleep latency or maintenance of wakefulness testing. So if you remember, we went through the definition of what multiple sleep latency or maintenance of wakefulness testing is. Now here comes another important thing which you should remember. Okay, this is about minimum recording threshold that can trigger a 52 modifier. So for a standard adult sleep studies, there must be at least 6 hours of recorded data. Now this applies to the code 95800, 95801, 95806 through 95811. So these all codes are for adult sleep studies. Okay, so for adult sleep studies, minimum of 6 hours of recorded data must be there, and if there is no 6 if it doesn't meet the 6 hour criteria, then you assign a 52 modifier. And for comprehensive pediatric studies, there is a minimum recording requirement of 7 hours. And if the recording is less than 7 hours, you will assign 52 modifier to the pediatric sleep study codes, that is 95782 and 95783. And for a daytime testing such as multiple sleep latency test, at least 4 nap opportunities must be recorded. And if fewer than 4 naps are recorded, you will assign 52 modifier to code 95805. So you can see right up here 95805. And if there is less than 4 nap recorded, then you will assign 52 modifier. So all these guidelines are available in your CPT manual. Make sure you churn them, make sure you highlight them so that you won't miss while coding these sleep study services. Okay, let's move on to the next topic for the day, that is nerve conduction study, or NCS. Now, nerve conduction study or NCS are diagnostic tests that is used to assess the function of peripheral nervous system. As you all know, the nervous system is broadly divided into two parts. One is your central nervous system and the other one is your peripheral nervous system. Now, central nervous system consists of brain and spinal cord, while the peripheral nervous system includes all the nerves outside the brain and spinal cord, such as your cranial nerves, the spinal nerves, etc. And during the nerve conduction study, actually electrodes are placed over specific nerves, and these nerves are then electrically stimulated and their response are recorded in real time. So this will help us to evaluate how fast and how effectively the signals will travel through the nerves. So these studies actually helps to determine whether there are damage to the nerve fibers. You can see the image of a nerve. You have a nucleus and then you have the axon and the fiber and the dendrites as well. So these nerve conduction studies actually helps to identify if there is any damage to the nerve fibers or to the myelin sheath. All right. And they measure different parameters like latency, amplitude, and conduction velocity. Now let's look into the types of nerve conduction study. Now there are actually three types of nerve conduction study. First is your sensory conduction study, and this evaluates how the sensory nerves carry signal related to the touch, pain, and sensation. The second type is motor nerve conduction study, which may be performed with or without F wave. So what is a F wave? F wave is also called as Fisher wave, and this is a special response during the motor nerve conduction study. So when a nerve is actually electrically stimulated, the signal will travels from the stimulation side to the muscle. Okay, so when a nerve is stimulated, first the signal will move from the nerve to the muscle, and that will produce a normal muscle response. Then the part of the signal will travel back to the nerve and to the spinal cord and then returns again to the muscle. So this returning of the signal is known as F wave. And also we have something called as H reflex study as well, which is known as Hoffman reflex. So here what happens is that this measures the sensory nerve stimulus. So or when a sensory nerve is stimulated, signal will go straight to the spinal cord and returns to the muscles. That movement is measured in H reflex. So nothing to memorize about this. There are three types of nerve conduction studies. One is sensory nerve conduction studies, motor nerve conduction study with or without F wave, and you have H reflex conduction studies as well. All right, three types of nerve conduction studies. Okay, now from a coding perspective, single conduction study is defined as either it will be sensory conduction test, motor conduction test with or without F wave test, and H reflex test. So let's understand this with the help of an example. So if a median sensory nerve is tested at the wrist nerve, then you count it as one sensory study. Okay, and if you have a tibial nerve H reflex tested for S1 pathway, you have one H reflex study. All right, and if you have both of these median sensory and tibial nerve H reflex study together in the same session, then you can count it as two nerve studies. All right, so remember what constitute a single conduction study. Okay, now each type of the nerve conduction study is counted as only once when multiple sites of the same nerve are stimulated or recorded. Now, for example, if you have a median nerve tested at the wrist and same median nerve is tested at the elbow, that would be counted as one motor or sensory study, not two. Okay, so yes, so remember, if the same test is performed at different location of the same nerve, it will be counted as only one study. All right, now you have some guidelines to follow when the nerve conduction study is performed along with electromyography study or EMG testing that we will study on the upcoming slides. Okay, now let's have a look into the nerve conduction study. It is not as complicated as the test looks like. So you have nerve conduction study codes from 95907 through 95913, and 95907 is for nerve conduction studies for 1 to 2 studies, 95908 for nerve conduction study 3 to 4 studies, and goes on till 13 or more studies. So what you have to do is that whenever you see a scenario, identify number of nerve conduction study done and then pick your CPT code. All right, and you have 95905, that is for motor or sensory nerve conduction study using a pre-configured electrode array, amplitude and latency velocity study each limb, and it includes F wave when performed. So 95905 is used when a pre-configured electrode array is used. It's a pre-configured testing device. All right. So this is all about the nerve conduction studies, and I think it's time for us to move on to the next topic, that is electromyography or EMG. Now, as we saw, electromyography is actually the study or diagnostic test used to measure electrical activity of the muscle, while nerve conduction study is used to identify the issues with the nerve. All right, so that's the main difference. EMG mostly deals with the muscle, while nerve conduction study or NCS deals with the nerves. Now, during the test, one or more small needles is actually inserted into the skin, and it is stimulated, and the various response are measured. All right, so that's what happened in a electromyography or EMG procedure. Now, EMG can be done in two ways. EMG can be done along with an NCS study, or EMG can be done alone. Now, the coding of EMG totally depends upon these two criteria. You can see if a nerve conduction study is performed along with the NCS, then you will code add-on codes which is available under the EMG category. Okay, I will show you with the help of the codes. That would be much better, I believe. So again, these EMG codes are classified based on number of extremities tested during the electromyography procedure. So EMG codes, EMG are standalone codes are 95860, 95861, 95863, and 95864. And as you see, these are classified based on the extremities. So if you have EMG test performed on one extremity, you use 95860. If EMG is performed on two extremity, you use 95861. If it is done on 3, you use 95863, and if you have 4, you use 95864. Okay, and these codes are for complete study. So what is a complete study? Complete study means 5 or more muscles will be studied in each extremity. All right. Okay, so let's move on to the codes for EMG. So as I said, if the EMG studies are performed alone, that is without the NCS, on those circumstances, you will assign these given codes. That is, these are all standalone codes. You have 95860, 95 through 95864, and as I mentioned before, they are classified based on the extremities tested. Okay, and you have a code 95870, which is for EMG limited study in one extremity. Now, I gave you the criteria for a complete study. What do you mean by a limited study? A limited study is when less than four of the muscles are tested in each extremity. You can see that in the guideline over here. Limited study is when four or fewer muscles in a extremity is tested. So when you call it a complete is when you have five or more muscles tested in one extremity. Okay, and we also have EMG codes on specific locations. So if EMG is performed on the cranial nerves, you use 95867. If it's done bilaterally, 95867 is a unilateral code. If it's done bilaterally, you would use 95868. Then you have code for thoracic paraspinal location and non-limb and other axial muscles. Also, you have code for larynx, hemidiaphragm, extraocular muscles, and sphincters as well. So these are those codes based on the location where EMG will be tested. Okay, now let's come to the second scenario when an EMG is performed along with the NCS. So in these scenarios, you have some add-on codes, EMG add-on codes that can be used along with the NCS codes. So let's have a look into those add-on codes. You can see the add-on codes. Three add-on codes are available. One is 95885, that is for needle myography of each extremity with related paraspinal areas when performed done with nerve conduction study. You can read those code language over here. When performed done with nerve conduction. Okay, that means these are used along with nerve conduction study codes. And 95885 is for a limited study. Again, you all know what a limited study is. Limited study means there will be four or lesser muscles studies on each extremity. And you have 95886, that is for complete study. And complete study means five or more muscles will be studied. And these muscles will be innervated by three or more motor nerves or four or more spinal levels. Okay, and we have 95887 as well, which is for needle electromyography non-extremity done with nerve conduction. So these are for non-extremity muscles. So they are your three nerve conduction, so no, sorry, three EMG codes that is to be used when EMG is performed along with a nerve conduction test. Okay, and yes, this is how I said what is a limited study and what is a complete study. Okay, another important thing to remember is that 95885, 95886, and 95885, 9985886 is for each extremity. Okay, so total we have four extremity, and that's a maximum number you can code. So if EMG is done along with the NCS on all the four extremities, then you can code 95885 or 95886 times 4. All right. Okay, so we have one more category, that is for ischemic muscle testing and guidance of chemodenervation procedure. So there are two important add-ons on guidance codes you need to understand, that is 95873 and 95874. 95873 is used for electrical stimulation guidance performed in conjunction with chemodenervation procedure. So if you remember, we also did cover the chemodenervation procedures. So if During a chemodenervation procedure, uh, electrical stimulation guidance is used, then you use CPT code 95873. Now, if a needle electromyography is used or needle EMG guidance is used with chemodenervation, then you assign code 95874. Okay, I know there has been a lot of codes and a lot of technical terminology which we discuss in today's session, and it might be feeling a bit overwhelmed. So let's simplify them by doing a coding exercise. Are you ready, coders? And this will really help you to understand what we learned today. Here we go. The first exercise. Of the following answers, select the correct CPT code for this procedure. Options are option A 95886 times 3, option B 95908, option C 95863, option D 95863, 95907. A 40-year-old patient presents for an evaluation of muscle weakness. Neurologist performs a complete needle electromyography or EMG on patient's right arm, left arm, and right leg. Of the following answers, select the correct CPT code for this procedure. You got this, Chorus. You got it. So read the code and read the muscles or extremities in which the test has been performed and pick your correct answer. Okay, your time has already begun. Place your best answers in the chat. Don't worry, even if you get it wrong, we will solve it together. All right, you guys are rocking it in the chat. All right, is there anyone else to please answer? I'll wait for a couple more seconds before we solve this one. Good job, great job. Okay, so let's go ahead and let's solve this one. So first thing first, let's have a look into the inventory list. We have in diagnosis inventory muscle weakness, and in procedure inventory a complete needle electromyography or EMG was done, right? EMG was done on right arm, left arm, and right leg. Okay, so we have three extremities in which EMG was done. Now it's time for us to look into the code options. First, let's look at option B. Option B is coding for 95908. Now it's a straightforward wrong answer because it's for a nerve conduction study. We are talking about electromyography, EMG test, right? Not a NCS test. So that makes option B, incorrect. Okay, now let's look into the next code. Also, option D also incorrect because 95907, it has 95907, which is also coding for a nerve conduction study. We only had a EMG test performed in this scenario. So option B is wrong, option D is wrong. We are left with option A and C. And I see that most of you have went with option C in this scenario. Option A is coding for 95886, which is incorrect because one, it's an add-on code, right? Yes, it's an add-on code, and you can see in the parenthetical guideline, it's been mentioned that you can only use 95885 and 95886 in conjunction with the codes 95907 through 95913. And if you remember, these are the add-on codes which should be used when an EMG is performed along with the NCS, right? So 95907 over here, 95907 through 95913, these are your NCS codes. So these codes 95885 and 95886, these are add-on codes to be used only when a NCS is performed along with a EMG test. So that makes option A incorrect, and the correct answer is going to be option C, needle electromyography, three extremities with or without related paraspinal area. Okay, and it's also important to note that this is code is for a complete needle electromyography test. Okay, it's been mentioned also that this is a complete needle electromyography that was done. Okay, let me know in the chat chorus, how are you all doing? Let me know. Okay, so meanwhile, let's move on to the next one. Of the following answers, select the correct CPT code for this procedure. You have option A 95861, option B 95910, 95886, 95886, option C 95910, 95886, 95870, option D 95910, 95886, 95885. A 52-year-old male patient presents with bilateral lower extremity weakness and radiating pain. Physician performs a nerve conduction study with 7 studies and needle EMG on both legs. On the right leg, 6 muscles are tested and documented as intervened by 3 distinct nerves. And in the left leg, 4 muscles are tested are are intervened only by 2 nerves and 2 spinal levels. Of the following answers, which best describe the correct CPT code? Okay, I hope this will be a challenge scenario. Let's see how we are going to do. All the best, coders. Place your best answers in the chat. The time begins now. Okay, okay, that was a bit challenging scenario, but from what I see in the chat, you all are doing a good job. Okay, okay, Miss Veena, you are amazing, everyone. Okay, great job, great coding by Franco, Terry, Star Girls. Amazing coding, amazing job. Okay, go ahead, place your best answers. I can see a lot of answers coming in. Diane, great job. Becky, great job. Letty Rena, good job, good job. Okay, so let's go ahead and let's solve this one as well. So here in the diagnosis inventory, okay, so once again my on clicks are not working. So let me show you what we have in diagnosis inventory. We have a bilateral lower extremity weakness and radiating pain, right? And in procedure inventory we have a nerve conduction test done, and there was 7 nerve conduction tests, right? In the scenario it mentioned there was a 7 nerve conduction test, and in this case a nerve conduction test was done along with a needle EMG test. Okay, so we have an NCS and EMG test performed. So first let's look at option A, which is coding for 95, I think it's 861. So 95861 is for needle electromyography, two extremities with or without related paraspinal areas. So it is only coding for EMG test. And from the guidelines, as well as what we have learned, we know that when EMG test is performed along with a nerve conduction test, so it's somewhere here. Yes, when EMG is performed with nerve conduction test, then you have to use add-on codes along with the NCS code. So that means you have two codes, one for the NCS and one for the EMG. And option A is only coding for EMG. That's why it's incorrect. Now, the next code is going to be, let's say, 95910. That's a good code, which is for nerve conduction study, the 7 studies. Yes, 95910 is for 7 to 8 studies. From the scenario we know that we had 7 studies done, so 95910 is a good code. Let's have a look. Okay, I have to just go back to see. Okay, now we have next code is 95886. Okay, we have eliminated option A. We have to look into the option B now. 95. All right. So okay, let me just one more try to see my on clicks. Okay, so next we are going to look at option C. Option C is going for 95870. 95870 is for a needle electromyography limited study of one muscle in one extremity, right? And why do you say 95870 is incorrect? Can someone let me know in the chat? Why would you say 95870 is a wrong one? Any guess? Let me know in the chat, coders. Quickly, let me know. I'll give you 2 seconds. Okay, it might take some time for me to see your response. Okay, I'll just wait. Anyone? Anyone? Why would say 95870 is incorrect for this scenario? I've already said the answer. It is because when you code a electromyography test with a NCS test, you have to use add-on codes for the electromyography, right? Not the standalone codes. So you cannot assign 95870 here. You must choose between the add-on codes 95885 or 95886, right? Is that clear? Please do let me know in the chat. So that's why I would say, okay, oops. That's why I would say option C is incorrect. Now let's look between option B and option D. Option B is coding for 95910, 95886 times 2. So 95886 is coding for a needle electromyography each extremity, complete 5 or more muscle study. Now, if you carefully look into the scenario, we have the EMG done on the left leg as well as right leg. And in right leg, we had 6 muscle tested, and they were innervated by three distinct nerves. So six muscles and intervention by three distinct nerves qualifies for 95886, right? So complete means five or more muscle study, and you can see here intervened by three or more nerves. So that is good code. But if you look into the left leg only four muscles were studied, and they were innervated by two nerves and two spinal levels. So that doesn't qualify for a 95886. That only qualified for a limited needle electromyography study. So 95885 would be the correct code for EMG test performed on the left leg. Is that clear, coders? Did the explanation help? Okay, I can see some yes in the chat. Let me know in the chat. If you need me to repeat, I'm happy to help. And that makes options B incorrect, and option D is going to be the correct answer. 95910, which is for no conduction study, 7 to 8 studies, and then you have 95885 and 95886. Awesome. Okay, thank you for letting me know. So always keep in mind, for nerve conduction study done with EMG, we have to use add-on codes as EMG test and NCS code along with the NCS codes. Okay. All right. Let's move on to the next exercise. Okay. So time is almost up, so I will quickly move on to the next one. Of the following answers, which best describe the procedure? Your options are option A 95811, option B 95808, option C 9580810, 95800 in option D. A 35-year-old female patient presents to the sleep laboratory for an attended overnight polysomnogram to evaluate the symptoms of daytime fatigue, suspected sleep apnea. Patient is prepped and monitored throughout the night by a sleep technologist who is physically present in the facility. To achieve full sleep staging, technologist applies frontal, central, occipital EEG, that is 3 lead, and a submental EMG lead, and a left and right EOG. Alongside sleep staging, technologist continuously monitors electrocardiogram, ECG, and oxyhemoglobin saturation, which is SpO2. A total of continuous recording time for the study is 7 hours. Final interpretation and diagnosis of the patient with mild sleep apnea and no continuous positive airway pressure or CPAP or BiPAP is required is initiated during the study. Of the following answers, which best describe the procedure? Chorus, your time begins now. Don't get overwhelmed by the length of the question. It's a straightforward one. Your time begins now. All the best. All right, Coda. So that's time. Give your best answers. I can see some of them already in the chat. Good job, good job. Okay, so it's a mixed response which I'm receiving in the chat. So let's go ahead. This is going to be a teachable moment, and let's go ahead and solve this one. Okay, once again, my clicks are off. So again, let it be. I'm going to explain them. So first, let's have a look at the inventory. We have in diagnosis inventory mild sleep apnea, and in the procedure inventory, there was a attended polysomnography test. Sorry, there is a spelling error. It was an attended overnight polysomnography test which was done. We have EEG, EOG, submental EMG, ECG, and SpO2. These five parameters were studied, right? Okay, so these five parameters were studied. And if you remember, so let's first look at option D. Option D is coding for 95800. I hope that's yes, 95800. And 95800 is for a sleep study unattended. As I said, we had a sleep study which was attended, right? Yes, technologist who was physically present in the facility. So 95800 is wrong. Next, let's go to option A. Option A is for a sleep study, or sorry, a polysomnography study, age 6 or over. Yes, the patient's age is 35 in our scenario, so that's good. For additional parameters with CPAP or BiPAP. Did we have a CPAP or BiPAP done in our scenario? No, right? It was clearly mentioned that no CPAP or BiPAP was done. That makes option A incorrect. Now, most of you were between option B and option C. Let's break this down. Option B is coding for 95808, which is for polysomnography, any age sleep staging with 1 to 3 additional parameters of sleep attended by technologists, while 95810, which is option C, is coding for polysomnography, age 6 years or older, sleep staging with 4 or more additional parameters of the sleep oops, with 4 or more additional parameters of the sleep attended by the technologist. Now, main difference between these two codes is that one is for with 1 to 3 additional parameters of sleep, and the other one is coding for 4 or more additional parameters of the sleep. So you all know that if you remember in the beginning, I said that there are three basic parameters that would be tested during a sleep staging or a sleep study, and these three parameters are EEG, EOG, and submental EMG, right? These are the three basic parameters of sleep staging. And along with it, if additional parameters are tested, that's when you code for the polysomnography series. So we had, in addition to the first three, we had ECG and SpO2, right? So there is only two additional parameters that were tested, and that's why I would select option B, 95808, which is for polysomnography, any age, sleep staging with 1 to 3 additional parameters of the sleep attended by the technologist. Okay, did the explanation help, coders? Was that an aha moment? If it was an aha moment, type aha in the chat and let us know. Let us know, coders. Okay, quickly let me move on to the last question. Please do let us know in the chat if the explanation helped. Okay. Okay. Great job, everyone. Great job. Great participation. I'm really happy seeing the participation. So, exercise number 4. Here we go. A 32-year-old, okay, of the following answers which best describe the procedure: 95810, 52 modifier, 95811, 95783, 95810. A 32-year-old patient with the complaints of loud snoring, frequent nighttime awakenings, and excessive daytime sleepiness The physician orders attended overnight sleep study to evaluate possible obstructive sleep apnea. During the study, EEG, EOG, submental, anterior tibialis, EMG, respiratory effort, nasal and oral airflow, EKG, and continuous pulse oximetry are monitored. Patient spends the 40 minutes in the bed with total sleep time of 221 minutes. The sleep efficiency is calculated at 56%. Study documents 256 arousal and 6 awakening. Oxygen saturation averages 95% with the lowest record saturation of 84%. No cardiac arrhythmias, parasomnia, or periodic limb movements are identified. Final interpretation indicates mild sleep apnea. Of the following answers, which best describe the procedure? Coders, your time begins now. Place your answers in the chat quickly. You got this one. You all have been doing a phenomenal job so far. Go ahead, place your answers in the chat. All right, coders, that is time, and I can see only one answer in the chat. Elegant coding. Okay, good, great try. So let's go ahead and we will see if it's correct or not. Meanwhile, coders, go ahead and give your best answers. Place your best answers in the chat, coders. I will wait for a few couple more seconds. Give your best answers, irrespective of whether it's right or wrong. Participation is the best thing. Okay. Okay. Great. Okay, great. Right. So we are again once again we will be having one more aha moment here. So in diagnosis imagery, I have a patient with mild sleep apnea. Procedure imagery, it's an attended overnight sleep study, right? And the parameters measured here is EEG, EOG. You have submental and anterior tibialis EMG, respiratory effort, nasal and oral airflow, EKG, pulse oximetry. So there is total around 7 parameters that were tested. Okay, now it's time for us to do a bit of churning, and you can see how I've churned my manual. And You will see how easily I'm arriving at the answer. So option 95783, which is option C, coding for a polysomnography. Patient's age is 6 years or younger than 6 years, right? So our patient's age is 32. So wrong age. I would say option C is incorrect because of wrong age category. Also, it's coding for with CPAP and BiPAP. We didn't add any CPAP or BiPAP. So option C is incorrect. Let's look at next one. Yes, let's look at next code, which is 95811, option B, which is coding for polysomnography. Patient's age is 6 and over. Again, for additional parameters with CPAP or BiPAP, no CPAP or BiPAP were used here. Again, that makes option B also incorrect. We are left between option A and option T. Now, both are coding for the same CPT codes, which is 95810, which is for polysomnography. Patient's age is 6 years or older. Sleep staging with 4 additional parameters attended by a technologist. Now, this is a correct CPT code because you can see there are 4 additional parameters that were measured, right? That were tested along with the sleep staging parameters. So is that part is good. Now, whether to assign a 52 modifier or not. If you remember in the beginning of the session, I had it said to keep in mind about those 52 modifiers. And the guideline do say that all sleep services include recording, interpretation, and report. Report with a 52 modifier if less than 6 hours of recording for the adult, for the adult sleep studies, which is code series ranging from 95800, 95801, and 95806 through 95811. These are all for adult sleep studies. So if the total sleep time is less than 6 hours, or the recording time is less than 6 hours, then you have to assign a 52 modifier. And if the sleep time for, or the recording time for the pediatric codes, that is 95782 to 95783, you can see these codes set 95782 and 95783 is for children whose age is less than 6 years. So for those codes, you would the time required is 7 hours, and if it's less than 7 hours, you can assign 52 modifier. Now in our scenario, it was a 32-year-old adult patient, so the minimum time required was 6 hours, and you can calculate. We have a total time spent which is 340, and the sleep time was only 221 minutes. So if you divide 221 minutes by 60, you will get around three and a half hours, right? So that's less than 6 hours, which makes option D incorrect, and option A will be the right answer. Okay, coders, how are you all doing? There you go. Aha. Excellent. Yes, let us know who else did had that aha moment. Who else had? So make sure you churn your manual, and if you churn it, you won't be missing it. Okay, let us know. Let us know in the chat. Did you had an aha moment or not? There you go. Excellent job. Great. So, coders, I think, do we have time for poll? I don't think we have already exceeded the time. So I will just skip the poll sessions, and yes, let us know, coders, how did you do? If you learned something, that is always priceless. And if you need more such videos or more such sessions, you can go into our AMCI YouTube channel and you can locate the playlist. From the playlist, you will find our CPT guideline mastery sessions over here, where you will find a lot of such sessions which we have previously done. Okay. And coders, please don't forget to fill that survey form. I expect everyone who attended the session to fill out that survey form. So if you want, you have a QR codes over here. Otherwise, I have placed the link in the chat. Please do leave us a survey form. You can also let us know the topics which you're looking forward for the upcoming session. That really help us to plan our content. Your feedback, remember, is extremely important, because only when you share it, we'll be able to come back with more such session that is tailored for your needs. Okay, so please do take that moment and let us know your thoughts. And also, don't forget to like the video. Please do subscribe and also share it with someone who needs to see this video. Okay, so thank you, coders. Thank you, team. Thank you, my team over there in the chat. Thank you, Miss Mills. Thank you, Miss Catherine, Miss Veena, Miss Diary. Thank you, everyone. Thank you, coders. We will be back next week with another topic. I think it's week 8, so mostly we might cover the E&M section. Okay, so those who are looking for the E&M session, join us next week. Till then, stay safe, keep coding, and also, once again, don't forget to fill out the survey form. All right, coders, have a great rest of the day.
4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast, we're all